Hi everybody, my name is Rhys Barber. I'm the audiologist here at Audiology Associates. Thank you very much for watching another subscribers questions answer video today. This is actually the second one we've done, the second episode. So if you've missed the first one, I'll pop a link to it up here. Check it out. There were some good questions answered in that one as well. So the first question today is from One and Only Panda. They want to know, do patients get to watch their video live while we're carrying out the procedure? They also want to know why we use oil and not water to help with the suction process. And also, is the suction tube loud? So to answer the first of those questions, our patients don't routinely watch their procedure being carried out live. The reason that we did start doing that, but what we found was as the patient's watching their procedure on the screen, as the suction tube starts to get closer to the wax, patients instinctively start to move away. So what we found was a little bit easier just to do it and just explain it to the patient as we're going along. If they want to see their procedure, we always show them at the end exactly what's gone on, and they can look at the screen on the endoscope so they can see the procedure in its entirety as we've done it. The second question was why we use oil and not water. When we use oil, it keeps the wax together, so it keeps it in a more solid block, but just softens the outside edges, so it means that we can get a really good grip on that wax, and we can then bring it out quite nicely. When you use water, it tends to really liquefy the wax. It turns to almost a mush, which means you're clearing much closer to the canal walls, which can be quite uncomfortable for the patient. The next question was, is the suction tube loud? It is noisy, so what you hear mostly, or the way that patients mostly describe it, is a lot of rushing and roaring sounds. If you've ever stood outside and there's a really strong wind blowing past it blows past your ear, and that kind of roaring sensation, that's the kind of sound that you hear when we're doing the suction. It's not unbearable, it is noisy, and obviously when you first do it, the patient usually can't hear very well because they have a lot of wax in there. So they do notice it gets louder the more wax we take away, just because they can hear it better. So the second question is from Ayla Dari, who wants to know if you get fluid behind the eardrum, how do you know you had it, and how is it treated? So fluid behind the eardrum is quite common, especially in the winter months when people have things like colds, when you're congested. So what would happen is you get a buildup of fluid in the space behind the eardrum, which will give you a very similar symptom to having wax in your ear. So basically what you get is a reduced hearing. Now, the reason for that is because the fluid is sitting behind the eardrum. When the eardrum normally vibrates when the sound hits it, it vibrates in and out of an air-filled space. But when you get fluid behind it, it is pushing against fluid, so it becomes quite stiff. So it doesn't vibrate the way it should, so therefore not passing the sound through as well as it should to the inner part of the ear. So the main symptom is usually reduced hearing. As long as there's no complications such as infections, then you wouldn't really get any other signs or symptoms. As far as how is it treated, in the majority of cases, mid-ear fluid will drain away itself. It just resolves itself over a matter of a few weeks. If you have sort of chronic mid-ear problems, for instance things like glue ear, which is quite common in children, then you may look at inserting a grommet to help to drain that fluid away, or may use some other device just to help to try and aerate the mid-ear space. The next question we have is from Kat. Kat wanted to know, if we're using forceps in a hairy ear canal, does it cause any discomfort for the patient? So for instance, when we're pinching out those hairs, it will feel like a small pinch if you grab a hair and pull it out with forceps, as it would with anywhere else on your body. So you will feel it if we pull out a hair, but at the end of the day, the relief you get from having the wax taken out, it far outweighs the second or two of sort of mild pinching you'll feel as you take one of those little hairs out. The next question is from Donna Woodman. She wants to know, is there any issue if you're removing ear hair? Does it cause any problems? Everybody has ear hair, okay? You should have some hairs on the outer part of your ear canal, which has a beneficial effect. It stops anything from getting inside the ear canal. So we're talking about sort of dust, debris, oh my God, in very rare cases like creepy crawlies, something like that, just getting in there. So it does have a beneficial effect. Now, some people's hair in their ear canals tends to get quite thick, or they grow quite a lot of it, in which case then it can have a slightly problematic effect, because what you can get is maybe the little hairs growing all around the outside of the ear canal may just sort of overlap, so it forms a little mesh, which then will stop some of the wax from coming away. So doing a little bit of gentle trimming can help sometimes, but in most cases, just leave the ear hair well alone and it will just resolve itself. Now, we have one more question, which is from Rachel Davis. Rachel Davis wants to know why someone's ear would itch a lot What can you do with it? There's lots of different reasons why an ear could itch. Obviously, if you have got itching in your ears, the first thing I would always recommend is go and see a medical professional, get it checked out just to make sure everything's okay. Certainly if it's a persistent itch, but there are some very simple explanations for it. It can be something as simple as anywhere else on your body you get itching, or dry patches and things like that, just because of things like shampoo use, or there's lots of different reasons. It could just be the ear canal just drying out a little bit. As far as what you can do, get some advice, okay? Always go along to a medical professional and just get them to take a look. Make sure there's nothing untoward going on. 9 times out of 10 there usually isn't, and they will just give you some advice as far as that's concerned. Now, there were some other questions that came up. There were 2 quite popular ones that came up that really could do with a lot more explanation than we would do in this video. So the first question was, how do we keep our ears clean if we can't use Q-tips? And the second was tinnitus. Now, I think both of those things need a really detailed explanation. So we're going to do videos on those separately to this. We're going to do standalone videos on their own just to explain those in a little bit more detail. But I hope you enjoyed watching the video today, guys. Don't forget, if you did have a question and you really want it answered, then pop it into the comment section below. Any question that's already been asked, if you'd really like to know the answer to that one, click a like next to that question. It helps me to see the most popular questions out there, and we can tailor the videos around those. And as always, guys, if you haven't already, then like, share and subscribe. And take care. Till next time.